My name is Dr. Oliver Barry. I'm a Pediatric Interventional Cardiologist. I've been doing interventional cardiology for 7 years.
My name is Dr. Ken Adiele. I'm a Pediatric Cardiologist and an interventionist.
The patients that got these cath procedures have serious congenital heart defects. It's quite an opportunity to be able to treat them in the cath lab and with these devices and techniques as an alternative to open heart surgery. So what's particularly exciting about bringing this to Nigeria is to serve and treat patients with severe and significant congenital heart defects that would be amenable to this type of intervention. While my surgical colleagues are hard at work doing open heart surgery, for these few patients we could offer an alternative.
It's an interesting area in the sense that some cases can be fixed, some heart conditions can be fixed. In a cath lab like this, where I am now, it's called a cath lab. There are different types of cath lab. In a cath lab, you could fix some heart diseases without surgery, without going through open heart surgery. So in that case, and then you just go through the veins and get into the heart and fix some of those conditions, and the next day the patient goes home. There will be no scar on the patient. There will be no morbidity of long hospital stay and other things. Risk of infection is less. You can actually take very critically ill patients that otherwise wouldn't be able to go through surgery and anesthesia. You will just be able to fix such things, and then, with minimal risk. It's like a minimal invasive procedure, and at the end of the day, the patient comes out very good. But it's just that it's not all cases that can be fixed by interventional cardiology. So selection is very important. We need to clearly select the cases that will be able to go through intervention. And for such cases, with best hands, the risk is minimal, and you'll be able to come out with a very good outcome. The next day, the patient goes home without any scar, and that's beauty.
One of the things that I'm trained to do and do all the time in my job in the US is to close these PDAs using a device. There are a few devices that are available to use and for that procedure. We use the patient's vein and artery in their leg. So a very small vessel with very small tools. Using X-ray technology, we watch where all our catheters and wires go, and we travel inside the patient's heart out to their lungs and take pictures using the X-rays so we can see this defect, this PDA that we call it, which stands for patent ductus arteriosus, so a ductus arteriosus that doesn't close. Thanks to some very generous companies, international companies, Abbott and Okwuosa, we were donated devices to use for this purpose. And so we chose devices that fit the anatomy for each of the girls and placed it across the defect. Both of them looked great, did great. The defects were closed. I'm proud that they've recovered very well and quickly, and they were ready to leave the hospital the next day. Both of them needed intervention. I think what's important is that we're able to provide that intervention for these girls in Nigeria, and so that they would prevent symptoms, and we could do it in a fast and safe and relatively easy way, so that they can recover quickly, get back to school and whatever else they're doing.